This conference will now be recorded.
Okay. All right. So as you see here, as I've been sharing with the classroom here on campus, that this lab quiz, right? This is your answer sheet. This is going to be able to help you when we're doing the quizzes. I'm going to drop 2 of the quizzes, so there's only going to be, so I'm going to make an addendum to my syllabus. There's only going to be 10 quizzes, right? That'll be for 10 chapters. And what I usually do is I'll do, so this first quiz that you'll have is going to be next week, okay? And that'll be on 2 chapters, I believe. Yeah, because I think it's next week. I'll look in the syllabus. But the first quiz will be 2 chapters. It'll be chapters 4 and 5. Other than that, it's only going to be, each quiz will be 1 chapter, be 25 questions, 20 to 25 questions, depending. Okay? Primarily, it's going to be multiple choice, true and false. You will see that the chapters have quite a bit of information, but know this, that you'll be able to have a 3x5 card, right? A 3x5 card, one side only. Okay, so one side only. You can write notes on that, and as you're taking the quiz, you may refer back to that little, quote unquote cheat sheet, so to speak. But it's not a cheat sheet because I'm allowing you to use it, right? So you'll have that 3x5 card that you'll be able to use while you're taking your quizzes. Okay. All right. So 10 quizzes. I'm going to drop the lowest grade out of those 10, and we'll go from there. So that's just a little bit of a change on the syllabus. Okay. But again, here, just to give you an example, like I said, when you do anything in the lab here, there'll be 2 lab quizzes. You'll be looking at models here on campus. Those of you that are online, you'll be looking at images that are blank, other than, they're not labeled, and you'll be able to have to label yourself and then submit those 2. Okay, so that's with the little bit of the testing, just to give you an idea. The final exam will be open notes, and you will have, it'll be cumulative. Okay, so that'll be a bigger test and exam. It'll be for the full semester, but again, too, you have your notes that you'll be able to come back to and look at and review while you're taking. Now, know this, that when you have to do some studying, right? Because if you don't, you're only going to be given a certain period of time to take your quizzes, right? So you can't just take 2 hours for a 25-question quiz. So you still have to put some time in to review, right? But again, like I said, I give you that little ability to create that 3x5 card and use it while you're taking it, or these word bank, we call it. Okay, let's see here. I want to pull up now our syllabus. So those of you that are online, you can see that we have the syllabus I have posted here, and those of you here on campus, you can see the syllabus. I'm going to try during the break today to make some copies. Did anybody print the syllabus already here in class? Anybody at all? All right, I'll print it out for you all, and I'll see across the way that the printer wasn't working, so I'll go downstairs when we, like I said, take a break and print this for you. But take a look what's going on as far as the syllabus is concerned. We're going to go through this and answer any questions. Folks, if you have any questions for me, so you'll see here that that's our course key for the Cengage textbook. Okay, now we have the textbook, and you can read it digitally. You can listen to it being read to you digitally. So when you have access to your textbook, start playing around a little bit with it, and you'll see that you can actually listen to it like an audiobook as well as read it yourself. I will provide all of the PowerPoints you'll see in documents and resources for our class. All the PowerPoints, there are notes, there are all kinds of support that I've given you for this class. Okay, so you'll have the PowerPoints for each chapter. Okay, and I've also gone through the work of highlighting each chapter for you. Okay, you also have access to, and I posted in the announcements page of our class. Yes, go ahead. It didn't work for what? For this? The manual. Okay. All right. Did you reach out to our IT at all and let them know? Okay, so check that out and see if they can help you with that. Okay. Yeah. So please let me know if you can't access that. Each week I will give you information. I'll share information with you. I'll go over what you need to do as far as the lab is concerned. So on Tuesdays will be lecture, Thursdays will be lab. Okay. And so in the lab, if you have laptops, bring them with you, please. Okay. So that would be important. And so this way you can do some work while you're here in the lab, in addition to doing the lab work that I'll have you do each week. Okay. So again, we'll be looking at models. You'll be doing, I have different handouts that I'll be giving you. So all to help you just learn this information. Okay. Go ahead. Sure. Yeah. Go for it. It's okay. You'll be fine. You'll be fine. Yeah. So you'll be doing some busy work here in the lab, right? While we're doing things. So it's okay. So that's no problem. If you don't have a laptop, that's fine. Even if you have anything else, even on your phone, you'll still be able to access certain things. So that's fine. Okay. You'll see here that I provide for you my contact information. All right. So Monday, Wednesday, and Fridays, I'm in the office from 9 to 5. Okay. Really not in the office on Tuesdays and Thursdays. Okay. And some Fridays and some Mondays, I might not be in the office. So you can just, you'll have to, if you would like to schedule some time to meet with me, that's absolutely fine and appropriate. And I can go over some things or answer any questions for you. Just let me know in advance. Okay. But yeah, usually that's my office hours, Monday, Wednesday, and Friday, and student services. Okay? All right. So here you're seeing, and it coincides with all the different classes that are given here on campus as far as the grading system is concerned, but I'll be more specific with our class. You'll see here as far as Instructional Support Center. So that's a link that you can go to help you. The Instructional Support Center, that link right there, as far as helping you regarding with testing and such. Really, for us, we're not going to have to worry about this. Okay? As far as the tests are given online, so there's no need to schedule an appointment in the ISC. Now, if you have any type of IEP, any type of issues that I need to know about, you need to share that with me, and you might then qualify for additional time when taking a test or a quiz. So let me know that, before prior to, please. Okay? As far as the ISC is concerned, so with this course, there shouldn't be an issue. Okay, but other courses you might need to have access to the ISC, and you can definitely seek them out. I would recommend that as you're looking at your schedule and seeing classes that you might need additional help in, register with them early on in the semester, like this week, right? This week, next week, and then start setting up times to meet with a tutor throughout the semester. Okay, so they're very helpful, but you should do that early on. It's free, but it's not, they can get full. All right, so look at your schedule, see what you might need to have help with, and go from there. I do recommend, so those of you that are online as well as here on campus, create study groups. Maybe once a week, get together with a few of you, right? And just review and go over some things for the class. You can meet in the library. You can meet on campus someplace. There's always places, areas that are quiet that you can meet, even in the hallways or outside as the weather is good. It's not a big deal. But I do recommend doing study groups. It's helpful. Okay. How many of you, anybody ever done a study group before? Been a part of anybody working with that? No? All right. Well, it's a good idea, honestly, and it's helpful. Let me move on here. So policy on cheating, right? So it goes without saying that you have the ability to cheat, right? You can do that online when you're taking a test. Here's the thing. When you're taking your tests, when you're taking your quizzes each week, right, that I'll have the quizzes for you, if you open up another window, it locks you out of the test, okay? If you're using your phone, I have no way of knowing that, right? This is why I create the quiz in such a way that you have only a certain period of time to do it, right? But you can cheat, absolutely. Is that ethical and moral, right? No. And should we be doing that? Should we even make that choice or even consider that choice? Never, right? Let me ask you this in the class here right now. Just please, just like raise your hand and I'll point out to you there. What kind of careers are you interested in? What are you looking for? Criminal justice, yeah. Would you want someone who's like, whether you're involved in being a lawyer or being a police officer or a detective or whatever, you wouldn't want someone like that to be unethical, immoral. It happens, does it not? Are there? In any profession, folks, right? There are people that are doing wrong things. Don't be one of them. Because here's the bottom line with that and doing wrong. They always get caught. You always get found out. How many people know of someone who's cheated like in a relationship on someone? Did they get caught? They always get caught. It's not like, oh, they're never going to get caught. They always get caught. And even if they don't, do you want to live with that kind of thing? Whether it's cheating on a friend, cheating on a significant other, or cheating on a test, or cheating on your taxes. Is that by any means any good stuff? It's never any good stuff. So, yeah. So I just, mention it and, leave it at that. The research papers. So I provide for you in the documents and resources how to do the APA citations, okay? So you'll see that in there. You'll look that up. If you need help with printing some things, let me know, okay? But honestly, there's like all kinds of stuff that I've given you all as far as notes and resources in documents and resources in our class that would be very helpful to you. Attendance. So yes, we do take attendance, and yes, you should be here, right? Because the bottom line, folks, is not only just that when you're not here, you're going to miss out on information, right? But you want to take part of like the whole thing of like you're in college, you're here to learn. Learn. It's all good. You'll have a good time. Some classes are going to be more interesting than others. That's just the way life is, right? But attend. And here's the thing also, is that you're doing financial aid and such, and you stop attending, we have to let them know. And what's going to happen with your financial aid? It can go like this, right? You lose it. You can lose your financial aid by not attending classes. So attend class, do well, pass your classes, and move on to the goals that you want to reach. So what is it in criminal justice that you'd like to do?
I'm not sure yet.
Okay, all right. Yeah. I mean, there's so much to do, honestly, seriously. And you know what? Criminal justice, not a bad paying job. Seriously, yeah. So, and benefits and such. Yeah, there's risks, but there's risks with anything we do. Right? So, yeah, good stuff. So attend class. Yeah, I want you to be here for sure. Okay. As far as the library is concerned, you'll see here that here's the hours for you. They're posted. So Tuesdays and Thursdays are late nights. Okay. So if you want to be in the library and set up anything and do things like groups, why don't you go to like one of the little, either the cafe or go off campus and go to Dunkin' Donuts or whatever and set up a study group, that kind of a thing. It's all good. I would love to go to Dunkin' Donuts right now also. Someone pointed out on the thing there. Let's see. All right, let's move on to, all right, here we go. Too funny. So do you like to laugh? Seriously. I know, right? It's good stuff. Like I enjoy that. I'll tell you that I've read quite a few books over the years regarding laughter as far as medicine is concerned and such. And the chemicals that are released as a result can be so positive and healing to us. So it's good to laugh. It really is. And I mean, right? You watch something funny and it makes you laugh and you're just like, doesn't it put you in a better mood afterwards and such? If you feel like garbage, if you feel like I don't want to study, I don't want to do things, pull up a cat video and there's something stupid. I mean, there's so much, and So TikTok, I have to say with a caution, right? TikTok can have some funny stuff and some like really like dumb, rude, ridiculous stuff. So just be careful what you're looking at. It's a lot of crap out there. So coming back to the outline here, good idea. It's just giving you an idea what we're going to be looking at. Right? I'm going to go also show you that. So body organization and homeostasis, looking at the skin, the integumentary system, chapter 4. So we'll be looking at it a little bit today and then finishing it up next week and then looking at the skeletal system. But you'll see here that we have all these body systems that I've listed for you all that we'll be looking at and going over and reviewing throughout the semester. Okay. The reason why I mentioned to you all early on regarding what's going to happen, here you'll just see as far as our laboratory exercises. You'll see there, 8th week, we're having our quiz as far as we're in lab on the 27th. Okay. You'll see there's another one at the end of the semester. Okay. The reason why I wanted to talk to you about testing right from the beginning is that I don't want you to get all flipped out about looking at, oh my gosh, there's a lot of information. 1, there is a lot of information. 2, I'm not going to make you memorize all that information, understand? But I want you to come away from this class and have a good working understanding of, hey, these are the parts of our bodies because you have a human body. Right? We need to know like what goes on with our own bodies. And so I hope that this class is going to be interesting for you for that. And again, helping you to know that you're not going to have to memorize everything. You'll have to memorize some things, absolutely. That's a part of learning. But I'm not going to, put you through that rigor like you would think for an anatomy class. So let's move on. So this is an important aspect of right now. So how is Dr. Perone going to grade you? Okay, how are you going to earn your grade here in this class? Okay, so on the 100 points basis, you'll see here that lab reports. Okay, any type of lab reports, any type of work also in Cengage. Okay, so any homework that I give you in Cengage, any lab work that I have you do here, so there'll be papers, handouts that you'll have to do. Those of you that are online, you'll have handouts that you'll have to turn into me. That's going to be worth 25% of your grade. Okay. You'll see here that quizzes, and I'm going to addend this. Okay, I'm going to make an addendum to this with the quizzes. Right. Also 25%. I'm going to remove 2 from it right off the bat, so you only have 10 quizzes, and I'll drop the lowest grade out of those 10 quizzes. Okay, so we'll do that. You're going to do a presentation for me. A presentation, low key, not crazy. Don't get all wigged out, right? It's not speech class, okay? And those of you that are online, you're also going to present to us also from online, okay? So we're going to be doing these presentations. You're going to pick some type of disease, and you're going to research it, okay? Not going to be crazy, but it's worth 25% of your grade. So not only just the research that you do and the paper that you produce, okay, using APA as the format, that will be a part of all this 25% of your grade. So that's pretty good, honestly, right? So you've got 75% there, and then the last 25%, the 2 lab quizzes and the final exam, all are factored in to that 25%, those 25 points. Okay, so you've got 100%, 100 points, however you want to look at it. But do you see how the grading here is that crazy? That's not bad, right? That's doable, folks. That's easily doable, right? So I understand and I respect the time that you folks are here. Okay, so I'll give you work to do. I'll teach you. I'll help you in any way. I'll answer any questions that you may have. Absolutely. But know this, that you're gonna have to do some work, but it's not going to be overwhelming. And I know that you have other classes other than my class, right? So I get that. So It's not going to be overwhelming to you, but you will have some things to do, absolutely. Okay? So that's the grading. So it works into 25% of each of those categories. Let's see here. When you're in the lab here, folks, so those of you that are on campus, when you're here in the lab, like I said to you, I don't have any screws in here that have like that aren't like a lid that you can screw on. No straws, that kind of thing. So just don't bring those in, okay? Other than that, there's no, you cannot come to the lab with open-toed shoes. So sandals are not allowed in the lab. That's a standard thing no matter where you are. I know we're not doing anything chemically wise and such, but it's just a rule, okay? So just if you're gonna wear sandals one day, that's fine. Just put them in your bag and then bring a pair of closed-toe shoes while you're here on campus for the lab, okay? Very good. Now you'll see here, let me move down here. The itinerary. And I'll give you specifics regarding the presentation and such as we go along. Okay, so I'll talk more about that. There, I just talked about the lab attire, talked about there's no eating or drinking in the lab. You know what? I'll allow you to drink in the lab, absolutely. If you want to have a snack, then just step out of the room for a few minutes. That's fine. Okay, but there is no eating in the lab. The drinking part, I'll allow you to drink in the lab. Okay, so the itinerary. You'll see here, so I've given you as far as today's the 8th, right? Thursday the 8th. So we'll be looking at chapter 4 today. Okay, we'll spend some time looking at it and reviewing, going over some information. I will not, finish that by any long stretch of the imagination today. Absolutely, I'll go over a few slides today. Absolutely, I will give you opportunity. So around 3 o'clock, we'll take a break. I don't feel like having you all just like sit there for a long period of time listening to me talk is really helpful to you all without taking breaks, because you'll just kind of go like this, and after lunch and such, it's a little bit tough. I get it. So we're the chapter 4, tissues, organs, organ systems. Before we take a break, I do want to talk to you a little bit about organ systems and such. So we'll do that. We'll be looking at the PowerPoints. I'll be sharing them. Those of you that are online, it might be a little bit different next time because I also have a speaker here that I use at the front, but there's some technological issues going on right at the moment, so we'll get that squared away. But you'll see here that so the first quiz, right? Yeah, there we go. So the first quiz you'll see will be here. It's going to be on 9/22. So Thursday, 9/22 to be on chapters 4 and 5. Okay. So I will even make an addendum, like I said, to this itinerary regarding the 10 quizzes that I'm going to be giving you all. Okay. But chapters 4 and 5. But after that, you'll see that there are quizzes on a regular basis. So I'm going to remove the quiz that's from Thanksgiving week. You're not going to be doing that quiz. So that'll be one, and I'll pick another time also throughout the semester when I think that things might be a little bit hectic for you all, that I'll remove another quiz for you. Okay, so I'll remove 2 of those quizzes, but on a regular basis, though, you're going to have. You'll see here that a lecture on a chapter, and then the following week, so chapter 6. The next week you'll have that chapter 6 quiz. Okay, and again, how it's going to work is that I'll open up the quiz for a time right after we're done here in class. Okay, so that's right there. So I'll have it open for the time. So we're here from 2 to 5, or a little bit before that, to 2 to 4:50. That many times it's like 4:30 or so. Between that 4:30 and 4:50, you'll be dismissed. Okay. But know that sometimes I will go right up to 4:50, and sometimes I won't, well, depending. Like I said, it'll be open from 5 o'clock. So 5 o'clock till Thursday 5, it'll open till Sunday 11:55. It'll close right before noon, right before midnight. Yes, go ahead. 2 lab quizzes. Yeah, 2 lab quizzes. So you'll see here that, let me just show you that again. Yeah. So there's 2 lab quizzes. Here we go. So week 8 and week 15. So week 8 and week 15. So week 8 would be 10/27. We'll have a quiz actually here. All right, those of you online, you'll be doing that online. But those of you who are on campus, I'll set up the room with some, either I'll do it at the front or I'll set them up throughout the room here. But you'll have models that you'll be looking at. You'll have your answer sheet, right? And then you'll pull from it and answer the 20 to 5 questions that'll be on that lab quiz. So on October 27th, as well as December 15th, those lab quizzes. Okay? Any other questions on that? And so you'll see here, folks, that we just go week by week. And again, I'll redo this with the 2 that'll be missing. So the week of Thanksgiving, I'll remove this quiz. Okay, so I'll remove that quiz from the week of Thanksgiving. And like I said, I'll choose another one. So those of you online, you'll see here on the 24th, there's not going to be, school is closed, but you also won't have that quiz for chapter 10, for chapter 11. There you go. And you'll see here that we will be doing presentations for, we would probably even end up doing quiz presentations on the 1st. So although December 1st says lab, I might give you a handouts for lab, but I would tell you that there'll be presentations here also. Okay, so again, I'll correct this. They get handed out to me. All right, so that's the itinerary. You can make changes, right? Go. So do me a favor, folks. So when you do get this, I would ask that you read this. So those of you online, you'll just copy and paste this part right here, sign it and date it, and just said, I have read and understand the expectations, assignments, assessments, and policies of this class as stated in the course syllabus. So I'll have you all do this also when I give this to you as far as a physical copy of it, okay? All right, so any questions from here so far? Are we okay? Pretty straightforward, right? I'm trying to tell you all that's expected of you, okay? But like I said, it's not so crazy. So it's very doable. And again, like I said, I hope that this is going to be a fun semester for you all. And I believe that you're going to enjoy all that it is that we cover. So before we go to break, and what I'll do, folks, is when we go to break, those of you that are online, I'll turn off the camera as well as the mic, and you're just going to have, there's just going to be some quiet time for about 10, 15 minutes or so, and then I'll turn it back on when we're ready, but it's still going to record because I don't want to have multiple recordings, so it's just going to be one recording. We'll go from there. So let me go to PowerPoint here. So before we move on and talk about the organs and the organ systems of the human body, I'd like to ask you a question, and I'll try and do what I can to, maybe you won't have the PowerPoint this week, but next week I'll make sure that you have this copy of this PowerPoint. So I'll print it out for you, okay? But what I want to ask you all is that when you're here sitting in the seats, right, and you're thinking about this class and deciding about what it is maybe that you want to do for a presentation, a paper, and such. Has anybody had interaction with talked with, seen a relative and such with a major disease process that someone that you care about is suffering with, and maybe like you might want to say like what anybody had a relative, a close relative, family member with cancer. Let's put like hands up for that, right? So we'll talk about that, and we'll talk about the processes that go on with cancer. But that's just one. What about? Go ahead, please. Okay, yeah. So if we were to say, we could use two words here to describe illnesses, right? We can say that they are we could use the words acute and chronic. Acute and chronic. So when you see those words, all right, I'm going to come around the room, and I'm going to just ask you to tell me what do you think acute and chronic might be? I like your marker. Big comic book theory, whatever you want to call it. What's a comic book? So when you hear, so what do you think when you hear those words, acute and chronic? Okay, that's valid. So both of them, how about this? Both acute conditions and chronic conditions can be mild or they. Okay. So when you talk about your mom suffering with that, would that be considered acute or chronic? You're right. You're right. So chronic illnesses are something that patient will experience over an extended period of time, and more than likely a lifetime. And chronic illnesses can begin with an acute episode, and they can also have these acute episodes that the patient suffers with throughout their illness. If I'm playing, I used to like to play hockey, okay? And playing hockey, okay, I'll talk about an injury that I had. I was playing in gym, right? And playing like touch football for the winter time. We didn't pull it out, so we were playing in this gym. This gym had like a professional grade carpet that you could play sports on and bounce basketball. So I'm playing, we're playing, and I planted my left foot, and I pivoted, and my knee hit. And I ended up having a medial meniscus tear, and ACL partial tear, and lateral ligament. Yeah, it was not a happy. I'm 58 years old, and I'm still not happy with it. I had surgery on it, but I'm going to need knee replacement. So I damaged it on that day, right? Planted, twisted, top, and like out, and dislocated. That day, my knee injury was an acute episode. Right? Now it's a chronic illness that I did. I went for therapy. I did things. I went to got surgery as far as removal of the tear, and piece that was torn, and as time has went on, especially as I'm older, right, and not as in good shape that it was in as I was younger, unfortunately, right? What happens with me? I can have acute episodes with this chronic condition of the. Okay? So I want you to get that and understand that a little bit regarding acute and chronic. That's very important. Okay? What about some other illnesses that you might know of that maybe family members experience? I'll go to you, and then if you don't mind. Yeah, so rheumatoid arthritis, yeah, so yeah, many times you're right. not all the time, but many times you're right. And that rheumatoid arthritis is a systemic type of a disease that can not only just affect just the joints, but it can affect other systems of the body. We're going to talk about body systems in a moment. Please. Yeah, so good health is not a fun thing. So my brother and I, we're both susceptible to it. I don't have gout. He does. He has gout. I'm telling you, gout is, you know, it stays, right? And how are you doing with managing it? Yeah. And you know what? What's interesting is that many times when we have these chronic illnesses will be exacerbated. That's a $3 word. I'll tell you what that is in just a moment. They're exacerbated by stress, right? Exacerbation means made worse, right? So it's not helping the matter. No, it's making it worse, unfortunately. And so, where are you experiencing the gout in particular? Yeah. Yep. So it's not only, yeah, so it has to deal with what's going on in the urinary system, and we'll talk about it in particular how the body produces and processes crystals, and we'll talk about that in more detail. Yeah, it's just, but these crystals can end up getting caught in joints, stuck in vessels, and it's just, it makes you not happy. So there is a genetic predisposition, absolutely. So I have 2 uncles that had gout for many years, and so my brother and I were in that line and susceptible. Yeah, absolutely. Oh yeah, I mean it can be. So I'm sure you've experienced times where you probably couldn't walk on the affected limb. Yeah. Yeah, I'm sorry for you. That's terrible. Seriously. No, not always. But so here's the deal: that depending upon the foods that you may eat, can cause an exacerbation, can cause an acute episode of. So we'll say, like, we'll use that word, an acute episode of your chronic condition, right? So that's a valid point. Okay. So yeah. So I'm sorry. Input. Yeah, so the acute thing meaning that, like, whatever the symptoms are for that, whatever the illness that you're experiencing is, like, they've gone up. Or, like, so you can have many times where you're asymptomatic. That's a good word. So there are no symptoms. When you're asymptomatic, no symptoms, that's correct. But when you have these acute episodes, you're symptomatic. Yeah. And so whatever those symptoms may be. And so sometimes the acute episode is really bad. Sometimes it's not so bad, right? How about anybody know of anybody that suffers with multiple sclerosis, MS? Okay. Do the person that you may know, do they have episodes of it, of like where they're not so good, and then episodes, and then time periods where they're good? Okay. Hmm. Okay. Yeah. So sometimes just the body and how it's able to work with the illness can just have these periods where things are good or the symptoms are minimal. But then the acute episodes can be not so fun, indeed. So yeah, acute, chronic, asymptomatic, symptomatic, you're expressing the symptoms, the pain, discomfort, the swelling, the edema, we would call that the swelling, right? Yeah, just lack of function also. So, imagine this, like, so with gout, right? So you'll have swelling. How about if I'm doing something and I twist and I cause some damage to the ligaments and the tendons? And we'll talk more detail in the next chapter about that. But ligaments and tendons, right? We would consider them soft tissue. How about when we're looking at the skeletal, right? So I said to that ligaments, tendons, how about muscles are soft tissue. What's that? What's the opposite of soft? Hard tissue, right? So absolutely. So hard tissue, soft tissue, they heal differently. So here we have an arm. Anyhow, sorry. Food always kind of like, just walking along outside paper or whatever. So anyhow, food. No, biceps. So the biceps brachii, right? The biceps brachii, we all know this, right? We can all do this. You feel contraction and relaxation go on. That's soft tissue. What anchors a muscle to the bone? What anchors a muscle to the hard tissue? The tendons. What helps to keep bone together? The ligaments. Again, we'll review this, but just know that when those structures, when the soft tissue structures get damaged, whether they have minor tears or major tears, that can many times take much longer than damage to the hard tissue. Okay, so we'll discuss that. We'll talk about healing and such. We'll talk about how the body does what it does in order to heal itself and repair itself. So we'll discuss that and get into that. But let's get over here to this slide that we came up to right off the bat. So I moved on into the presentation to just show you this slide, and then to talk to you a little bit about the body systems. So you'll see that there are 11 organ systems present within the human body. Okay. We have different cavities. I'll talk about those later. I want to discuss the systems here. I like this slide coming up next. We'll come back to the cavities. This slide right here is very good. Write this information down for me, please. When you look at that body, right? See this body right here? We would call that body an organism. Just like we would if we looked at any other creature, right? We would say that that's an organism. So a bug, a bear, a lion, a cat, a dog, an organism. So we'll use this word organism to describe the human body. So the human body, the organism. The organism is made up of what? Organ systems. So the organism is made up of organ systems. Those 11 organ systems are composed of, what is this word right here? Organs, right? So the organ systems are composed of organs, and those organs are made up of tissues. So they're made up, so I'm going to write it over here, folks. So the organism, organ systems, remember there's 11. Okay. The organ systems are made up of, comprised of organs. Those organs are comprised of, or made up of, composed of tissues. Those tissues, take a look at these images here for a moment. What do you think these structures are that I'm pointing at right now? Oh, go back. That these tissues are made up of. What are these little yellow things here? You don't have to be specific, but just say, starts with a C. They're cells, that's correct. So the tissues are composed of cells. And actually, the arrow, I should really put in this direction, because that's what you're looking at as far as we're at the cellular level. Cells are groups of cells are what? They're tissues. So if I have a bunch of cells all together, they make up tissues. Different tissues coming together to perform a function are organs. Different organs are composed in these organ systems. And all of these organ systems, the 11, right, all come together to function to allow for the organism, the human body, to do what it needs to do. Okay? So it's important that you get that breakdown, right? The organism to what it's composed of. And so that's what I'm giving you here right now. Cells, tissues, organs, organ systems, organism. Okay. In the next two slides, you'll see here that we have the organ systems are shown to you all. Okay. So you'll see there the integumentary system. So in your notes, put that's the skin and its components. Right. So the integumentary system, that represents the skin. And hey, how about hair and nails? All these different accessory structures, in addition to the skin, are the integumentary system. The nervous system, this is your brain, your spinal cord, your nerves, and all the cells that are associated, right? The nervous system. The muscular system, muscles, tendons, these are all actively involved in not only just moving the body, but there are different types of muscles. That's skeletal muscle. So when you think of the muscles that can move your skeleton, that you have conscious control over, skeletal muscle. But there are other types of muscle. There's smooth muscle and heart muscle, cardiac muscle. We'll talk about this in more detail. The skeletal system, the bones, the cells that are comprised of, that make up the skeletal system, the different osteocytes and other types of cells present, as well as the ligaments that help to hold, and the cartilage that's present also, skeletal system. So when it says circulatory system, you can also use the word, I like the word better, the cardiovascular system. Cardiovascular. Because then circulatory, you're just thinking of, okay, well, it's just like, I'm thinking of the vessels, the blood vessels. But really, the cardiovascular system is the heart and all those vessels and all the cells, right? So again, remember that the cells, the tissues, the organs, all comprised in these and composed of these present within the organ systems of the human body. And lastly on this slide, the endocrine system. You've all heard, I'm sure you've all heard of the two words, thyroid hormone, right? You've probably heard that, thyroid hormone. How about growth hormone? How about testosterone, right? How about estrogen, progesterone? These are all hormones, folks, okay? So the endocrine system, it's all of the different glands and structures that will produce, secrete the hormones, these chemical messengers present within the body. We'll go into more detail, but just giving you a little bit of a sneak peek at what's going on with these organ systems. So hormones. So the term so the endocrine system, hormones, and glands that produce them. Then we have lymphatic system. So how many of you have seen someone who would have like a swollen arm, like the whole arm would be swollen, would be edematous, swollen? How about, have you seen people that have a leg or both legs that have swelling, have edema present? This has to deal with the lymphatic system as well as the cardiovascular system. But the lymphatic system also is involved in your immune response, your ability to have immunity, as well as the cardiovascular system, right? The blood cells. So lymphatic system, cardiovascular system, they work together to provide your immune system. So the immune system, I'm going to write that term down because I want you to know it. And you know it already. You've heard that term used. The immune system. It's a functional system. So I'm not going to say to you that, what is the immune system? Well, you know, the immune system really is not just one system. It's what? It's the cardiovascular system and that lymphatic system working together. That's your immune system, okay? So it's not a part of, when I ask you, when I say the immune system, it's not part of the 11 organ systems, okay? Because the immune system is really using cardiovascular and lymphatic in order to provide your immune response. Respiratory system, the ability to process gases, right? So we take in oxygen, we take in nitrogen, we take in other gases, right? And then we exhale CO2 and such. And so we'll talk in much detail regarding the respiratory system. And really, honestly, when I share with you and teach you how these organ systems work, there's going to be aspects of the organ system, right, that you're going to go, wow, I've never realized that before. And so that's why you're here in Dr. Crumb's class, because we're here to learn new things that you can take on with you after you're done with this class that you'll remember for a long time after. How about this? Next one here, digestive system. Digestive system, it's a big tube, right? It's one continuous tube from your mouth to the anus, right? To the hole that allows material to enter in, hole that allows material to exit out. Continuous tube, larger areas, smaller areas, will vary. Many chemical processes going on throughout that tube. Chemicals are being added, different processes are taking place in order to break down food, and then processes that we can absorb it and use the nutrients. The urinary system. Here's something that you may not know, and raise your hand for me when you hear this said. The body filters blood to produce urine. How many of you knew that? How many of you knew that? Right? That's like kind of weird, is it not? Because many times we think that the body takes in liquids through the digestive system, and then it's like that's how you're producing the urine as far as a waste. Well, no, the solid waste, right? Fecal material, that's the waste from the digestive system. The urinary system, we have these kidneys there, we have the storage area, the bladder, filtering blood, producing urine. And again, when we talk about the uric acid and such, we'll go more detail regarding gout and such, and we'll discuss the different diseases for each of these systems. Please. So why would a kidney infection maybe be pretty severe, or something that you don't just let go? You don't not treat it? Because yes, so this can affect the cardiovascular, it can affect the blood, because folks, one, that infection that's taking place, it can cause things to block up and to have issues with what's exiting from the kidneys, right? And it can also, this infection can spread even further deeper within the body and such. And so it's a kidney infection is a severe infection. And what can happen is that you can have an infection that starts here and moves its way up. Or what can happen also is that if you have kidney stones, this can also block the flow of urine out of the body, and this can lead to issues with infections and such, and not good things indeed. Yeah. So urinary system. Then lastly, the 11th system, male and female reproductive systems. Right. We'll go over that at the end of the semester, and we'll be talking about the structures as well as how they function, and we'll be talking about the cycles that take place as far as for female structures and such. And so I think you'll find it very interesting. So those are all the body systems. I'm going to give you one more thing before we take a break. Just real quick, I'm going to write on the board, then you can take a break. And so how I help my students to remember this is that if you remember this little mnemonic here, Miss Curly Nerd. Kind of a weird thing to say, right? But here's the deal. That gives you all of the body systems: muscular, skeletal, cardiovascular, urinary, respiratory, lymphatic, integumentary, nervous system, endocrine system, reproductive, and digestive system. So that's one way, an easy way to remember all of those 11 body systems. Okay. Once you're done with that, you can go take a break. So folks that are online, I'm going to turn off the camera and I'm going to turn off the mic, and I will escape here. There we go. Stop sharing my screen with you all. Jennifer, I'm going to mention that when we come back to class. Thank you for sharing that. Good. All right, folks, I'm going to turn off the camera and the mic for those of you online, and we'll return to class at 3:30. Okay, folks, welcome back. I had to go make some copies and such. I want to mention what Jennifer had mentioned in the chat box. So one of our online students mentioned that one of my employees has lost 2 fingers and 2 toes from gout. It's awful. It's in every one of his joints, he's completely deformed. And wow, that's pretty sad stuff. I mean, yes. You know, with all of these different disease processes, I want you to know that, no, it's not you. With all of these disease processes, really, it's a matter of that, you know, patients can suffer mildly. We use the terms mild, moderate, severe, as far as the levels of what they're dealing with and suffering with, unfortunately. All right, so thank you, and thank you for those in class here that have shared information. So I'm going now to the beginning of the PowerPoint. Again, we're not going to finish this PowerPoint today. We'll go until about 4:15. I'm looking at today. So we're going to get a little bit early today. So you'll see here that epithelium, the body's coverings and linings. Okay? So when we think of the skin, the integumentary system, right? Epithelial tissue, this special type of tissue. Remember, you have tissues are made up of cells, organs are made up of tissues, organ systems are made up of organs that are made up of tissues that are made up of cells. So this tissues, groups of cells, epithelial tissue is a type of tissue. Epithelium, it's a type of tissue. This tissue you'll see here, it covers, and I've highlighted for you, and it lining of cavities, of tubes. So think in terms of the tubes in your body, right? There are all kinds of tubes. Digestive system, tubes. Cardiovascular system, the blood vessels, tubes. Lymphatic system, those lymph vessels, tubes. Tissues can cover the body's surfaces. They can also cover the different organs that are made up of, that are present within the human body. Interesting here, it says here one side faces an internal body fluid or the outside environment. So the skin, yeah, the skin we would say the outside environment. Sorry. As far as lining, so lining those blood vessels, lining an organ. So look over here. I'll show you. So we have a stomach over here. So here we have a stomach. So as it's present within, like this. Okay. And so what's going on? What's this structure you think right here? What do you think that structure is for underneath the lungs, right? At the base of the lungs. What's that red? What do you think that might be? Starts with a D. D. Die. So if you're looking at, look at where the organ is. So there's the lungs are right here. Here's the diaphragm. What's this yellow structure? Any idea? The esophagus, where all the liquid and food passes from the oral cavity, esophagus. That's where then all of the foodstuffs go down into the stomach, right? Well, if I open up the stomach, so here we have, folks, the stomach. And if I open it up, what does it look like inside of the stomach? What do you think that looks like? Good, good. Does it look smooth? Not smooth, right? Definitely not smooth. Okay, so it has these rugae, these folds that allow for, what do you think the stomach will do if it fills up with material? It's going to do what? Expand, right? Expand. So these folds, these rugae, they allow for that. So there's food in there, right? And I'll talk about the type, what goes on in there, not now. But there's food in there that enters into that area. There's also acids, very acidic, like acidic to the point where if you were to put your finger in the acid, that would damage your tissues of your fingers, right? So, but what goes on as far as what's inside here? Is there a lining? There's a lining of here, and there's also mucus present to protect your stomach from being worn away by the digestive juices present within that stomach. Okay? And so there is epithelial tissue inside there, also lining, and like I said, there's also present different things like an alkaline mucus that prevents the acid from eating away. What happens when the acid starts to eat away at this structure, at this stomach? Go ahead. Ulcers, right? Yeah. And so if an ulcer perforates, is that a good or a bad thing? That's a bad thing, right? Because then what happens is that the contents from your stomach, that acid with the food, your stomach, if the contents of the stomach, that acid in the food, if that leaks out into, so let's look over here. If it leaks out into here, or how about, folks, if we look at, remove small intestine, the large intestine, right? This part of the small intestine is called the duodenum. Section of the small intestine right there. Many times that also can have an ulceration. So the stomach or the duodenum can have an ulcer, and that can allow for this material to leak out. And have you ever heard of peritonitis? How many of you have heard of that? Peritonitis. Well, it's something that can kill you because it's a bad infection that can go on. Go ahead. Yes, it can absolutely. This infection can go throughout the whole body, and it's very severe. Yeah, it has to be addressed, or there can be dire consequences for sure. So we're talking about tissue. We're talking about epithelial tissue, covers and lines. You'll see here also that, so with this epithelial tissue that lines the organs, that lines the blood vessels, that lines all the vessels, the tubes in the body, the other surface rests on what's called a basement membrane. So look at the board here for a moment. I'm going to erase this. So what I drew here right now, that's one cell. One cell. It's called a columnar, a simple columnar epithelial cell. This is the top. This is the bottom. There's proper words that we would use to describe the top and the bottom. We would say the apical surface or the basal surface for top and bottom. Top and bottom. Apical for the top, basal for the bottom. There also can be many other kind of structures here. I'm going to put these hair-like structures. This is called cilia. They're like hair. They allow for material to move along that apical surface, that top surface of the cell. So think about having like mucus, right? You know what mucus is, right? You've seen it as far as like you have something in your sinus, in your nasal passage, and you spit it out, and that's mucus, right? So we get mucus. So mucus is really protective. It's a good thing, okay? But sometimes we produce too much of it, okay? And so that can be an issue. But mucus that can attach to these cilia can help to grab onto particulate matter that's not good for us, say like in the respiratory system. And so that's a good thing that this mucus can attach to cilia. So just get that, all right? But that's the top surface. That's exposed to the inside of a tube. All right, so imagine that my roll of paper towel is a vessel. Say it's a blood vessel, okay? Blood vessel. What's the inside of this tube? What would we call this if it were the inside of a vessel, of a tube? We would call this a lumen, the lumen of a tube. L-U-M-E-N, the lumen. The inside, okay? The inside of something. So that lumen, right? It can either get smaller or bigger, depending upon whatever type of tube-type structure. Right? But know that inside of that lumen, whether it's a blood vessel, whether it's part of the digestive system, there's something going on inside of there. And so the apical surface of cells, the epithelial tissue that are lining this lumen, so folks online, the lumen would be the inside of some type of tube, the lumen. So this could be a tube, or it could be the lumen of the stomach, okay, or an organ. So that lumen, there are these epithelial tissues, this cells. So the apical surface of this cell is where the lumen, it's exposed to the lumen, okay? What's anchoring that tissue that's lining that inside of the vessel, inside of the tube, would be what? The basement membrane. That's what you're seeing on this slide here. Basement membrane, that's what's lining it. So that basal surface, the bottom area, it has this basement membrane that anchors it. Just like you have a basement in a home, right? Same kind of a concept there. It's at the bottom. It's anchoring, right? That's important for you to remember and to know. Why would I put an N on this circle? What do you think? Go ahead. That's correct. Good. That's the nucleus. Okay. So we have this one cell. Okay. Now, I said to you that we're kind of naming it, right? We're going to see this as we go along, but I said it's simple columnar epithelial cell. Isn't this like a rectangular column shape? That's why we call it columnar, column shape. Okay, simple enough. So let's move on to the next slide. So in this next slide, you'll see the terms that we're using to describe this type of epithelium, epithelial tissue, covers and lines. Simple epithelium and stratified epithelium, as well as in the middle, pseudo stratified. Simple, one layer. Make that note, one layer simple. Simple, one layer. Stratified, layers. So it's more than one layer. It could be two, it could be three, it could be many. Simple, one layer. Stratified, many layers. You've heard that term strata used before, as far as in geology and such, and they're talking about the strata, the layers of the earth, right? The layers of rock, strata, stratified, right? We have layers of these cells in this tissue. So it's layers of cells. So right here on the board, if I draw a few more cells, we would say that this would be simple, one layer, one layer of cells. Pseudo stratified. So in using the term, the prefix there, pseudo, it means that it's false, right? So it's not, it may look like it's stratified, but it's not. Looks like there are multiple layers, but it doesn't have multiple layers. Where might it be good to have one layer of cells? Anybody have any thoughts on that? Where might it be good to have one layer of cells so that material, something can pass from one area to another area? There's only one layer. Go ahead. So skin, so good thought, but skin, multiple layers. And here's the reason why. Because skin, what are we doing? Are we like bumping up against things and know that like the cells at the top are dead and they're dying and they kind of like fall off of your body, right? When you look at this is cool. So when we look at the sun's rays coming into a room, say the room's dark, but we can see the sun coming into a room. When you look at the sun's rays coming into the room, what do you see present within the rays? What do you see present? Dust. What's that? What do you think that dust is primarily? Dead cells from your skin that have sloughed off, they've kind of brushed off, multiple layers. Simple, one layer. How about in the lungs for gases to pass from one area to another? One layer. That's a good thing. How about present within tiny blood vessels like capillaries that allow for movement of material from one area to another area? That's important. So one layer. But multiple layers, again, the skin. How about what's going on inside of the stomach here? Do you think it would be a good idea to line it with multiple layers? Absolutely. So multiple layers are good for, they can absorb abuse, they can take damage, and there's other layers to protect and still be there, be present. So simple, pseudified, stratified. And here you're just seeing in this slide, you're just seeing an example of different types. Now, it always is a little weird when I try to teach. You all won't have to be able to identify slides, but in the anatomy class, they have to be able to look at slides and determine what type of tissues are present in particular. And that can be a little challenging at times because you'll see here that this looks like there are, I don't even know, right? It's like all different types of cells and kind of weird looking, but understand that this right here, it's only simple. It's only one layer of this type of cuboidal cells, cube-shaped cells, okay? So I'm going to draw on the board over here. So look up on the board what I've drawn. You can see it also over here. This flat pancake shaped, almost like looking like an egg, so to speak, would be a squamous cell. Squamous. What do you think this one is? What does it look like? Does it look like a square? Does it look like a cube? So this would be cuboidal. And what is this one again? We just looked at that over here. Columnar. It's a column-shaped cell. Columnar. And know that these different types of cells have different types of function, right? Depending upon their structure really helps to dictate, helps us to understand helps us to be able to realize that they have a different function. That's a big deal. Yeah. And know that as we're even looking at, finishing that up on the board, as we're looking at these different organs, these different muscles, brain, different shapes, types of muscle, the different shapes, types of bones, right? Very unique in here. Their structure determines their function. So that's a big part of understanding anatomy and physiology, is that structure determines function. Structure determines function. So the anatomical structures determine the physiological function, the physiological, how they physiologically work with the other organ systems to do their job. That's about as simple as I can put that. Right? Let's see. So you're seeing here, just this next slide, we're giving you the layers, whether they're simple, one, stratified, multiple, pseudo stratified, not it looks like it's multiple, but it's not. And then the different cell types, and then where they would be located within the body. Okay, so you're seeing here that simple squamous, lining of blood vessels, the lungs, these little sacs called alveoli. Cuboidal, simple cuboidal, glands and their ducts. So a gland is producing some type of liquid, okay? Some type of fluid, some type of better word, secretion. So a gland produces a secretion. And a duct, a D-U-C-T, tube. A duct is a tube. So your tear ducts allow for tears to pass through those tubes. You'll see here simple columnar, stomach, intestines, the uterus, so digestive and the reproductive system. Pseudo stratified columnar, your throat, respiratory system, male reproductive system. Stratified, squamous, cuboidal, columnar, we have here, you'll see the different regions and areas where they're present. Okay? So again, the structure determines the function, how they do what they do. So here we have glands. Remember before I said to you about endocrine system? That was one of the 11 systems of the body. Endocrine produces hormones. So it makes hormones, and these hormones are leaked out into, not leaked, well, released, better term, released into the cardiovascular system and going to different areas of the body. But those tubes, ducts, tubes, exocrine, these glands are producing, how about saliva? How about sweat? How about oil? Oil producing glands are called sebaceous glands. So these are exocrine type glands. So we have these two types of glands. You'll need to know the difference between the two. Saliva. And so these tubes that are produced, these tubes that are a part of, that work in conjunction with the exocrine glands, right? The vessels that are receiving those hormones from the endocrine system, they all have these different types of epithelial cells present in order for them to do their job, in order for them to carry the secretions from these different glands to areas of the body that need it. Okay? Questions at all at this point? Go ahead, please. Sure, yeah, absolutely. Yep. That one? You also know that, like I provide for you on documents and resources, you have these slides, these digital slides present for you, okay? Okay, so I think we're going to stop there with this, but I want to talk to you a couple minutes before we head out. All right, folks, so online I'm going to just share an area of the internet with you all. All right, so have you ever seen someone that has something like this on their body? You've been out to a store, you've been at the doctor's office, you've seen maybe somebody, or maybe on the internet, or maybe on TV. Have you ever seen someone with something like this where they have these multiple little bumps throughout their body, on their skin and such? This is called neurofibromatosis. Neurofibromatosis. And what this is, folks, is this is a type of illness where genetic disorder can pass down from one generation to another, or there can be a mutation that takes place with the patient that it just as a result of some type of environmental factor that the mother is exposed to while she's carrying the baby, the developing child. But this can lead to issues where these bumps develop in only certain areas of the body or all throughout, covering the body and such. When I was in chiropractic school back many years ago, I had a patient in the student clinic in the outpatient in downtown Atlanta. So I worked in the downtown Atlanta, right actually, and I forget the year of the Olympics. There was Olympics that took place in Atlanta. I forget what year. Anybody remember it all? I don't remember off the top of my head. Well, the clinic where I practiced was in a very rough area of town, and projects, you could use that term that would be used, right? And it was torn down, and then they put housing for the Olympic Village and such there. But this is where I practiced downtown. It was not far from Georgia Tech. Have you ever heard of Georgia Tech at all? Not far from there. And so this outpatient, I ended up taking care of a husband and wife. And the wife was friends with a woman who had neurofibromatosis. And very interesting to talk with this patient and work with her. And very interesting also to, as a chiropractor, we're palpating, we're touching people's backs, right? Touching their backs, their necks, trying to determine what's going on, in addition to doing x-rays, right? In order to see what's going on underlying. But there's a lot of touch involved because we actually do, and I use hand manipulation, pushing on different areas and such to make change to help patients who are in discomfort feel better, and as well as people who are not really in discomfort, but maybe had lack of motion, right? We'll talk about that when we talk about the skeletal system. And so anyway, I took care of this patient, and very interesting to talk to her about life in general, because when you look at somebody that looks like this, that has this going on in their face, can you imagine what that is like to live with that, right? Is that easy? Is that an easy life that that person has? Even if, and know this, that this can also be uncomfortable and painful, right? Because it's connection with the nervous system. So this is not like just painless, okay? This can be uncomfortable, quite uncomfortable, depending upon the areas and such of the body. But not only just having it, you look like this, but you also have issues with pain and discomfort as a result. That's not an easy life, is it? I want you to understand and come away from this class, right, to have a better appreciation for the human body and how it does what it does. And that also we're going to learn about different disease type processes, right, where the human body, amazing as it can be, can have issues where parts of the body don't develop or work like they properly should. And the how we all take for granted how we look and how we feel. Truly, we do, right? I drive to work from Pennsylvania. I live in Pennsylvania. I grew up in Wayne, actually. Anybody know Wayne, New Jersey, right? Yeah, I grew up in Wayne, my wife and I, and then I went to grad school, undergrad, grad school, and went to Georgia, and then from there went to Pennsylvania and practiced in Pennsylvania for my years. Right now, I live a half hour from the campus. I travel through country. I travel through farmland. I hit one stoplight coming to work in 30 minutes. You're not impressed? Come on, man, that's impressive. That's, you know, I mean, that's cool, right? Like I grew up in Wayne where it was just like very congested, very, you know, always stop and go, stop and go, stop and go. You know, but here's the thing. I travel through beautiful land, but do I always appreciate the pretty areas that I'm traveling through? I take it for granted. We all take for granted how our bodies are just doing what they need to do. But if you have a problem, if you have gout, if you have some type of illness, do you not take for granted so much that your body is working like it properly should? Absolutely, we do. And you know, like I'm telling you, and I'm telling you, you will, as time goes on, something's going to be a problem for you physically, right? And so this class helps you to just have a better understanding of what's going on with the human body, how it works, and have a little bit better, you know, reality as far as the human body and what it can do. So I hope it's like it to me, when I study the human body, it's humbling. It humbles me because it's like I can't even get over how complex our bodies are and how we're not sick all the time, to be honest, right? You know, we've dealt with this whole COVID and coronavirus situation, and wow, it's been a rough couple of years, right? And we're just recouping and getting back to where we need to be and such, but it's not been easy. But even still, many of us have had COVID. I've had COVID, right? Had shots, I've had COVID, you know, we've had different illnesses and such. But again, how are we not always sick? That's amazing. That is incredible. So that's what I want to leave with you today, is that I want you to appreciate the human body, and I want you to enjoy the class. Really, I truly do. I will do all that it takes to make it interesting for you all. We'll go from there. All right, guys. Thank you for being here today. Appreciate you all, and I'll see you on Tuesday. Cool. Take care. We'll see you too. Have a nice weekend, guys. How is it Thursday already? Oh my gosh. Ay, ay, ay. The weeks go by very fast. Take care, folks. Yeah, bring up those papers if you can remember, please. Thank you. You know what? If I can read it, it's okay. If you don't mind, yeah, that'll be helpful. If you could print, yeah, if I could read it, it's all good. If not, just, you know, thank you. Take care, folks. Have a good one. Nice meeting you too. Take care. Take care, guys. Thank you. You also. See you guys. Oh, good. Thank you. I appreciate that. All right. Oh, cool. Nice. Awesome. Very cool. Very cool. All right. Thank you. Thank you. You too.
Nice to meet you.
Thanks. You also. Take care. All right. So it's been a good class, and I hope you all enjoyed it. Take care, folks. Those of you online here, if you have any questions, I'll stay on here for a few minutes here if you need anything. Bye, guys. Take care. I'll just leave it open for a little bit. If you want to put a question in the chat box, that would be fine. Thank you. And I'm going to stop recording. Here we go.